Okay, so now let's talk about real world application of stem cells in spinal and MSK conditions. So, what does that actually look like in practice?
So, this is what I'm doing a lot of these days. And the low hanging fruit are joints. So many people have knee problems here in the US. You have a knee problem, maybe sports, or maybe you had a arthroscopy surgery, which accelerates the degenerative process. And by middle age, you're getting cortisone shots or hyaluronic acid lubrication shots, and they just aren't lasting long enough. And you go see your doctor, they do an x-ray, and the orthopedist says, well, you're bone on bone, you have arthritis, let's do a replacement. And there are thousands and thousands of joint replacements done every day in the US. So one of my goals is to help reduce the need for that. It's still quite a barbaric thing. It's needed in many cases, but if we can delay it, put it off, and maybe even prevent it in some people, I think we're doing them a service. So we take people, we evaluate them. Where's your pain? The basic history and physical, get to know them. I order a very highly specialized MRI on a 3 Tesla machine, which in clinical practice is the higher quality machine, even though in a couple academic centers they have a 7T and I think an 11T now. But these are the higher resolution pictures where we can really dig in. And I order from the secret menu of the MRI center, I order what's called an inversion recovery image, or STIR. And many times you have to ask for that special. Doesn't cost any more, but it lets us look at the bone marrow just adjacent to the cartilage. Why? The cells that originally made that cartilage when you were a fetus and baby, the cells that maintained that cartilage, replaced that cartilage, lubricated that cartilage, are in the bone edge. And the work of the French doctor I mentioned proved that treating the bone edge was statistically superior, longer lasting than treating the cartilage. Because you think about cartilage, it's a protein product of the cartilage making cells in the bone, just like hair is a protein product of a follicle cell in your scalp. So the chondrocytes are the cells that make cartilage, live in the bone edge where the bone marrow is, where the stem cells are, where the growth plate is. So we deliver the stem cell derived exosomes to that subchondral bone based on targets we see on that specialized MRI. So we do the clinical correlation with the MRI, and then we bring that patient into an injection facility under sterile conditions using some twilight sedation. And I've already done the targeting, and I will inject into the bone above and below the cartilage. Takes about 6 to 12 months to get the kind of results we want to see because the regenerative process takes a while. And usually it's a one-time procedure. And that echoes the results of the French group who has 15-year follow-up.
So, how does the you assessing the marrow help with this treatment?
Because we can see inflammatory changes, sometimes referred to as subchondral edema above and below the knee, or in the spine, they're called Modic changes, named for Professor Dr. Michael Modic of the Cleveland Clinic. And these are inflammatory bone changes above and below the cartilage. When that cartilage is losing its cushioning power, the bone marrow feels it and gets cranky, and it can be seen on an MRI if you ask for the right sequences on a high quality. So we use those for targeting. Dr. Herngau in France, in a separate study, also showed that you could take patients with osteonecrosis of the hip, where the bone marrow dies in the head of the femur, and you can inject stem cells. Of course, he didn't have exosomes when he did the study because they're relatively newer. He injected stem cells into the bone and was able to bring back to life, reanimate the cells of the head of the hip, and they had clinical improvement because guess what? They now can make cartilage proteins and lubricate the cartilage. So the health of the cartilage of the joint is a measure of the health of the bone marrow cells at the edge just adjacent to that cartilage. That's the process of osteoarthritis, and that process can be slowed and reversed.
So, does the delivery method of the stem cell or exosome matter? Like whether should you inject in a joint space, intraosseous, or IV therapy?
Yeah, IV therapy, if you have little aches and pains, inflammatory changes everywhere, we've done IV. It's not enough to help you fully regenerate joints, but it can help suppress inflammatory pain. I have a sweet little old lady. She's 82 now. She comes in every couple years because she can't use her fingers because of her osteoarthritis. She can't do her cooking and her crafts. She comes in, we give her an IV, she improves, and I say, call me when you need me. And then she comes in 2 years later. So we can do that. Injecting it to the joint can have benefit, depending on how bad the joint is. But what's happening is you're injecting these biologics into the cartilage, and retrograde, they're going into the bone. Now, remember, the cells are too big to go into the bone. The exosomes are going into the bone. They're small enough to penetrate. Well, I say that's inefficient. The best practice is to put them where they're needed. So I put them into the bone, and I can target them very specifically. And just like Dr. Hernigo, who proved you can get better results and more lasting results by injecting the bone, we're seeing the same thing.
Before we dive back into this incredible conversation, there are a couple of exciting opportunities with disruptive doctors that I want to share with you guys. First, if you're a doctor who's thinking about moving into a non-clinical career but don't know where to start, or even if you're a doctor who's on the fence thinking if you should leave medicine or stay, the non-clinical career pathfinder by Disruptive Doctors is designed specifically for you. The problem why we doctors think that there's no opportunities for us out there is because we've been trained in sick care all our lives, but that's not true. Healthcare is a huge ocean. What you learn in this workshop is discovering yourself, where to find all the opportunities within healthcare, your game plan, and insights from me and Vivek on how to do it. And the best part is it comes with a 14-day guarantee. By the end of this workshop, you gain so much clarity on what you need to do, or if staying in medicine or leaving for non-clinical practice is for you. Our proven framework has helped more than 1,000 doctors on finding a fulfilling career. So stop wasting your time trying to figure it out all on your own in the dark. So sign up for our next workshop on our website. Next, mark your calendar for Disruptive Doctors Annual Conference and Exhibition. It's happening this 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025. And finally, if you haven't already, please download the Disruptive Doctors app. It is a global hub where you can connect, collaborate, share experiences with doctors across the globe, and you don't have to be limited by geography. This is more than an app, it's a movement. So be part of the community of doctors who are impacting healthcare differently. And also, can you be doing me a huge favor? If you have not subscribed to the channel yet, please be sure to subscribe, because it's subscribers like you that help us bring better guests for you. So whether it's the workshop, the conference, the app, or just subscribing to the channel, be sure to do it now. Now, let's get back to the conversation.
Join Disruptive Doctors. Oh, Disruptive Doctors. Impact